Dysfunction Files, Episode 26, The Folate Block You've Never Heard of, FRAA, Leucovorin, and the autism debate they don't want you to hear. Well, it's been a wild week in the news. Okay, well, this will be last week based on my release schedule, but whatever. Tylenol, vaccines, autism, something called leucovorin that you've never heard about for treating autism and ASD, all rolled into one conversation. That's a lot to unpack in one episode, so we may need to break this down into several. But today I want to quickly get at least the information on leucovorin out into the ether, with the caveat that I am a doctor, but I am not giving medical advice. This is my commentary. I'm just a girl who talks to herself when her kids aren't home. Oh, and this week I have a lisp on account of my ongoing dental work, so just ignore it. What if I told you a child could have perfectly normal folate levels on a blood test, yet inside their brain it's as if folate doesn't exist at all? Their speech stalls. Their development freezes, their world shrinks, and the culprit? Not bad parenting, not genetics, not some vague mystery of autism, but an autoantibody, an immune system mistake blocking the brain's access to a critical nutrient called folate. It's called FRAA, Folate Receptor Alpha Autoantibody. And the wild part? We've had a safe, cheap, decades-old treatment sitting on the pharmacy shelves the entire time, leucovorin. But just as this story is breaking, the government is stirring the pot with claims about Tylenol, vaccines, and the true causes of autism. Today we're opening the file. I'm Dr. Kristen Lindgren, and welcome back to the Dysfunction Files. Today, we're diving into a story that's been hiding in plain sight, a missing link in autism that almost no one is testing for, and a decades-old therapy that could change lives. Let's get into it. The folate mystery. Imagine a toddler who used to babble nonstop. Now, silence. She stares through people, not at them. Labs all came back normal. Folate? Fine. B12? Fine. Thyroid? Fine. The pediatrician shrugs. Some kids just develop differently. End of visit. But here's the kicker. That child is living with a folate deficiency so severe it's strangling her brain, yet every test says she's fine. Folate in the body versus folate in the brain. Folate is vitamin B9. It's the architect of brain development. It builds DNA and RNA, drives methylation, and makes neurotransmitters. Without it, neurons misfire and connections break down. So how do some kids look folate starved with perfect labs? Enter Cerebral Folate Deficiency, or CFD. Folate must cross the blood-brain barrier. In CFD, the blood is full, but the brain runs dry, like a fridge packed with food in the garage while the back door is locked. Symptoms include regression in speech, clumsiness, irritability, or autistic features, sometimes seizures. And because serum folate looks fine, doctors miss it. The brain keeps starving. The invisible culprit, FRAA. Scientists found the lock on the back door. Folate Receptor Alpha Autoantibodies, or FRAA. Blocking antibodies? If you have blocking antibodies, folate can't dock to the receptor. If you have binding antibodies, they distort the receptor and transport fails. Blood folate is fine, brain folate is gone. It's like a bouncer at the VIP club. Folate's got a ticket, but FRAA says, nope, not tonight. Autism and FRAA. Studies show the presence of FRAA in up to 60 to 70% of kids with autism. Symptoms overlap almost perfectly. For some, this isn't mystery autism at all. It's a specific, treatable deficiency, and almost no one is testing for it. Why pediatricians miss it. Standard labs only check serum folate. FRAA testing is specialty. Pediatricians aren't taught anything about this in residency. Families get psych referrals, speech therapy, maybe a stimulant, because nothing says root cause like another script for Ritalin. Think about that. Tens of thousands of children worldwide may not have mystery autism at all, but a specific, treatable deficiency hidden behind normal labs, and hardly anyone is testing for it. Here's the setup. Kids are regressing. Folate levels look normal, but in reality, their brains are starved because autoantibodies are blocking the gate. A silent saboteur, a lab no one runs, and a fix that's been hiding in plain sight, one pill away. But the dysfunction doesn't end there. Because just as the science is getting clear, the government decided to blow the whole thing up with claims about Tylenol, vaccines, and autism. We'll get there. But first, let's talk about the unlikeliest hero in this story, an old chemotherapy rescue drug called leucovorin. But don't expect your pediatrician to tell you this. Most have never even heard of FRAA. You'll get more progress Googling autism diet at 2 a.m. than you will from a 20-minute well child visit. Leucovorin, the old drug with a new trick. Every good crime story has an unexpected hero. Sometimes it's the detective who won't let the case go. Sometimes it's the overlooked neighbor who remembers the crucial detail. In this story, the hero isn't a slick new pharmaceutical. It's not some billion-dollar biotech injection. Nope. The savior here is a humble, decades-old vitamin called leucovorin, better known as folinic acid, a downstream biologically active form of folate. And trust me, this is not the comeback Big Pharma wanted. From chemo rescue to autism breakthrough, leucovorin's resume is unimpressive at first glance. Originally developed as a rescue agent in chemotherapy, when oncologists gave high-dose methotrexate, a drug that nukes folate metabolism, they used leucovorin to save healthy cells from total annihilation. For decades, leucovorin sat in the shadows, a sidekick, an afterthought, cheap, generic, no marketing team. Until researchers started asking, what if this little folate cousin could sneak past FRAA and unlock the brain's back door? How leucovorin works. Unlike regular folic acid, leucovorin is already a reduced active form of folate. It doesn't need as much conversion by MTHFR or other enzymes. More importantly, leucovorin can cross into the blood through alternate transport systems, bypassing the blocked folate receptor alpha. Translation: even if FRAA is locking the back door, leucovorin slips in through the side window. The clinical trials. Dr. Richard Fry and his colleagues at the University of Arkansas ran the largest studies. High-dose leucovorin, up to 2 milligrams per kilogram per day, max of 50 milligrams per day, given to children with autism. Results? In FRAA-positive kids, they saw dramatic improvements in speech, language, social interaction. Some even regained lost skills. FRAA-negative kids? Less dramatic results, but still measurable gains. Parents reported things like first words after years of silence, better eye contact, reduced repetitive behaviors, the kind of changes no one forgets. Imagine watching your child, who hasn't said I love you in years, suddenly whisper it at bedtime. That's not placebo. That's biology. Why this matters. In the autism treatment world, most interventions are either behavioral therapy, like speech therapy and occupational therapy, or medications that manage symptoms, stimulants, SSRIs, antipsychotics. Nothing actually directly targets a root cause. Leucovorin is different. It restores folate flow into the brain, correcting the underlying metabolic roadblock in this subset of autism spectrum disorders. Even in FRAA negative kids, FRAA's studies showed benefit. Folinic acid still boosts methylation and neurotransmitter synthesis, which may help even without FRAA. But because it's a vitamin, it's generic, safe, and costs pennies, don't expect it on your pediatrician's top 10 miracle list. There's no CME courses teaching physicians about this, no drug reps taking them to lunch over leucovorin. Side effects and safety. Overall, leucovorin is extremely safe. It's a B vitamin and basically has the same potential side effects you would have if you suddenly took a heroic dose of B vitamins right before bed. The most common side effects are hyperactivity, irritability, or trouble sleeping, usually at the start or when dosing is too high. Mild GI upset, like nausea or loose stools. Rarely changes in seizure threshold, though some kids improve. Clinicians manage this by starting low, 0.5 to 1 milligram per kilogram per day, splitting into 2 doses, titrating slowly to the full therapeutic range. Give earlier in the day to avoid bedtime issues. Compare that to the side effect profile of risperidol, weight gain, diabetes, movement disorders, and you tell me which sounds like the better bet for a 5-year-old. Elephant in the room, methylfolate. You might ask, why not just give methylfolate, the active form? Well, the answer is methylfolate still depends on the blocked folate receptor to get into the brain. If FRAA is the problem, methylfolate won't fix it. Methylfolate is great for systemic methylation issues like MTHFR SNPs, and many of these kids have those too and benefit from general methylation support. But in FRAA kids, leucovorin is the one that bypasses the block. Think of methylfolate as a shiny sports car stuck at a closed toll booth. Leucovorin is the backroads shortcut nobody told you about. Why you haven't heard about this? Well, I've got a couple ideas. No drug company is going to fund billion-dollar trials for a vitamin they can't patent. Pediatricians aren't taught about FRAA or leucovorin in residency. The FDA only just now began acknowledging it for autism-related symptoms after years of pressure. So parents find out from online forums, support groups, and the occasional forward-thinking integrative doc. Do you need the FRAA test? Every good mystery has a lab test, right? A fingerprint, a DNA swab, the bloody glove. In this case, it's a blood test almost no one has heard of, the Folate Receptor Alpha Autoantibody, or FRAA test. And while your pediatrician is busy ordering the 14th CBC of your child's life, this one never makes it into the menu. What the test actually is. FRAA is a simple serum blood test. It checks for autoantibodies that block or bind to the folate receptor alpha at the blood-brain barrier. There are 2 flavors of autoantibodies. Blocking antibodies, which directly prevent folate from entering. And then there are binding antibodies, which stick to the receptor and interfere indirectly. If your child is positive, their brain is literally being starved of folate despite normal blood levels. It's like finding the burglar's fingerprints all over the back door. Suddenly, the mystery makes sense. How to order it? Well, there's only a few places that actually run this test, none of which are Quest or LabCorp. With a physician lab order, we can get our hands on these test kits, which are run by these certain labs. Does insurance pay for this? Well, FRAA is largely considered to be experimental, so probably no. However, cash pricing is not $1 million. The cash price on the test is somewhere in the couple $100 range, plus or minus. Do you need the test before starting leucovorin? Short answer, no. Why? FRAA positive kids show the largest benefit: speech, language, eye contact. FRAA negative kids, some still improve. So, a lot of clinicians skip the test altogether and go straight to a therapeutic trial, especially since leucovorin is safe, cheap, and low risk. So, you don't need CSI level lab confirmation to try fixing a broken lock if you've got a spare key. Why parents want the test anyway? Well, it gives validation. This isn't just in your head. Here's proof your child's brain isn't getting folate. Helps predict response. If the test is positive for blocking antibodies, those are the best odds at leucovorin being successful. Results can help guide dosing and expectations. Why doctors don't order it? Well, they don't know it exists. They've never been taught about FRAA or CFD. It's not on the standard autism workup. And let's be honest, insurance headaches make most docs allergic to send out lab kits. So instead of ordering the one test that might actually explain regression, you'll get another referral for speech therapy and a pep talk about early intervention, which is great, but it's like fixing the wallpaper while the house is still on fire. Practical pearls for patients and clinicians. If you can afford it, FRAA testing gives useful info, especially if you need hard evidence to justify leucovorin to skeptical providers. And if you can't, a leucovorin trial is still safe. It's a vitamin, reasonable, and supported by clinical studies. Either way, the response is what matters, not just the lab. So, here's where we are. We've got a blood test that solves the riddle of normal folate with abnormal brains. We've got a generic vitamin drug that slips past the blockade and gives kids their voices back. We have parents crying because their child finally made eye contact. And we have a medical establishment that can't quite figure out what to do with this inconvenient little pill. But just as leucovorin is gaining traction, the government walks in and announces that autism is caused by Tylenol and maybe vaccines, and that leucovorin is the savior. That's where we go next. The Tylenol vaccine bombshell. You all saw it. The White House podium, cameras rolling, and the words you're not supposed to say in 2025. Tylenol, vaccines, and autism all strung together in one sentence. If this were a Netflix special, you'd assume it was satire. But no, this was real. The announcement. September 2025. Trump, RFK Jr., and HHS officials announce a new autism initiative. On one hand, the FDA formally acknowledges leucovorin for autism-like symptoms linked to folate transport dysfunction. That's a huge deal. On the other hand, they tie it to mounting evidence that acetaminophen use in pregnancy, Tylenol, and possibly vaccines may play a causal role in autism. I'm just going to leave the latter right there. Let's talk about this Tylenol situation. They cite observational studies showing associations between prenatal acetaminophen use and increased autism risk. The White House calls it compelling evidence and urges pregnant women to avoid Tylenol unless absolutely necessary. Sounds dramatic, but swap compelling for wow, that's a stretch. These studies are observational. Confounders are everywhere. Effect sizes are vastly inconsistent across studies. Okay, so I did the deep dive on this. First of all, I hate Tylenol. Tylenol is the leading cause of liver failure in this and many other countries on account of both intentional and accidental overdose. The therapeutic dose, or safety window, is tiny, 3,000 to 4,000 milligrams per day in adults. If you accidentally take 7,000 to 10,000 milligrams because you have a cold, and every cold medication on the shelf at Walgreens has Tylenol hiding in it, you could nuke your liver. But those things aside, Tylenol does something more. It depletes the body of its most important antioxidant, glutathione. If you run down your body's ability to put out inflammatory fires, you'll find yourself in a world of trouble. Do that to a developing fetus? A baby? All these things we inject into children cause inflammation. on purpose. They're meant to trigger an immune response. So, yes, injections and Tylenol and other environmental toxins deplete the body of glutathione, and in so doing, potentially result in neuronal inflammation and the clinical picture we call autism. Whether there's a real link between Tylenol and autism or not, don't take Tylenol. It's garbage. Why tie this to leucovorin? This is where things get weird. The administration positioned leucovorin as part of the, quote, solution, almost like Tylenol or vaccines caused autism, but leucovorin is the fix. You see, this is a messy mashup of real science, folate receptor autoantibodies, with shaky science, acetaminophen and vaccine stuff. The dysfunction angle. Here's the reality. Leucovorin works, especially in FRAA positive kiddos. Tylenol autism links? Interesting, but probably related to glutathione depletion and not necessarily the Tylenol. But lumping all this together creates chaos. Politicians get headlines, families get confusion, doctors get angry emails, and once again, the real progress, FRAA testing, leucovorin treatment, gets buried under the noise because spectacle always sells better than science. Okay, so what's real? FRAA exists. Folate Receptor Alpha Autoantibodies block folate transport into the brain. Cerebral Folate Deficiency, or CFD, is real. Kids can have normal serum folate levels, but deficient cerebral serum folate levels. Leucovorin works. Clinical trials show significant improvements in FRAA positive autistic children, especially with language and social interaction. It's safe. Side effects of taking a vitamin are mild and manageable. That's not conspiracy, that's data. It's published, it's replicated, it's happening in real clinics every day. Practical takeaways for patients and clinicians. Ask about FRAA testing. It's a serum test available through specialty labs. Your insurance probably won't cover it, but it's not $1,000. Consider a leucovorin trial. Even without the testing, it's cheap, safe, and supported by evidence. Start low, titrate slow. Support methylation, especially if genetic SNPs are involved. B12, methylfolate, magnesium, diet. Closing. FRAA is real. Leucovorin works. Kids are improving. That should be headline news. Families don't need more spectacle. They need answers. So don't get lost in the recent noise. Ask about FRAA. Trial leucovorin if it's safe for your child, because dysfunction doesn't stand a chance, not when you focus on what's real. That'll do it for me. I'm Dr. Kristen Lindgren, and thank you for tuning into another episode of the Dysfunction Files. If you found this episode useful or entertaining, please like the video, subscribe to the channel, leave a comment, and share it all with a friend. As always, those things are easy, totally free, and really help the channel out. Until next time, stay skeptical, keep learning, and together we can improve the state of our children's healthcare. I'll see you for the next one. Bye for now.